Hello, my name is Mark Wakefield. Over the next few minutes, I would like to share with you some interesting historical facts on the development of the healthcare system in the United States. Healthcare in the United States has a dynamic and storied past. From the oldest public hospital established in 1736 to the Affordable Care Act implemented by President Barack Obama in 2010, the goal has been to find a way to take care of the individuals living within the geographic regions of what would become the United States. History has a story to tell, and the challenges and successes encountered have developed the United States healthcare delivery system that we know today. The purpose of this presentation is to outline several key milestones in the development of the United States healthcare delivery system, the rationale for these events, important legislations, and key players who were involved in making history. In addition, we will take one significant event and elaborate more in depth the factors surrounding the event, including the connection between the event itself and the social and economical background that drove the change. It is imperative that all individuals have access to affordable health care, and history shows that while the United States has not yet adopted a universal healthcare system, the systems implemented have been created to protect as many individuals as possible and allow them to obtain access to the care they deserve. Let's start in the 1700s. In 1736, on March 31st, Bellevue Hospital, the first public hospital in New York, opens to provide assistance to the poor. Bellevue is one of the oldest hospitals in the United States and is still in operation today. In 1756, College of Philadelphia, which eventually became the University of Pennsylvania, became the first school to offer medical training in the colonies. In 1798, President John Adams established the Marine Hospital Service to care for sick and disabled seamen. This organization would eventually become the National Institute of Health. Today, this institute has become the primary federal biomedical research agency and is the largest such agency in the world. In the 1800s, the American Medical Association was founded to improve education. Having a mission of standardizing medical education, this organization was a driving force for the concept of private practice in medicine. In 1879, on March 3rd, a law created the National Board of Health. This implementation was the first organized, comprehensive national research effort of the federal government. In the years of 1910 to 1915, in order to hold employers accountable for worker injuries and to protect workers from paying their own medical bills, 32 states created workers' compensation insurance. During this same time frame, on August 14th of 1912, Public Health and Marine Hospital Services changed their name to Public Health Services, and medical research was expanded. In 1929 and 1930, one of the first hospital service plans, created by Baylor University, was implemented for people to pay for hospital care. The plan cost 50 cents per month and covered 21 days of care in the hospital. In 1947, the Taft-Hartley Act was implemented. This required health insurance as a condition of employment. In 1965, Medicare was introduced as a single-payer health insurance for Americans 65 and older, as well as some younger people with certain disabilities. Medicaid introduced to provide coverage for lower-income adults, children, and people with certain disabilities. As these programs became implemented, Congress also recognized that medical education needed support, so the federal government provided ongoing funding for teaching hospitals. Now that we've reviewed a few timeline markers, let's take a moment to look at some of the key legislation that formed our system. In 1854, the Bill for the Benefit of Indigent Insane, one of the earliest healthcare proposals introduced at the federal level, was vetoed by President Franklin Pierce, based on the premise that the federal government should not commit itself to social welfare. In 1933, Franklin D. Roosevelt, while drafting provisions to Social Security legislation, included public funding health care programs. His success allowed for multiple private insurers, including Blue Cross, to emerge with multiple groups of hospitals. In 1949, President Harry S. Truman proposed universal health care, but the legislation failed to pass. This action highlighted the opposition of the organized medicine to universal health care, and this seemed to set the standard for the decade starting in 1912 until the support of the Obamacare in 2010. In 1951, the Internal Revenue Service ruled that group premiums paid by employers is a tax-deductible business expense. This change solidified third-party insurance companies' place as the primary providers of access to health care in the United States. In 1965, perhaps the most significant change to the United States health coverage was the passage of the Medicare and Medicaid into law on July 30th by President Lyndon B. Johnson. The American Medical Association and insurance companies opposed the passage of this law because it was too close to socialized medicine, and they felt it would reduce the quality of care. Nevertheless, it passed with overwhelming support from the House and the Senate. In 1996, the Healthcare Insurance Portable and Accountability Act, also known as HIPAA, became the major healthcare regulation concerning fraud, abuse, security, and privacy. President Bill Clinton enacted this legislation, which required the Department of Health and Human Services to establish national standards for healthcare information and the privacy and protection of that information. And then in 2010, President Barack Obama enacted the Affordable Care Act to help make affordable health insurance available to more individuals, expand the Medicaid program, and support innovative medical care delivery methods designed to lower the cost of health care. Healthcare in the United States requires reliable communication, accurate data, and patient privacy to protect the consumer as well as the organizations providing care. Legislation and healthcare policy cannot thrive and succeed unless these objectives are met. So let's look back at HIPAA and elaborate a little bit more on this program. As previously stated, 1996 was a pivotal year for fraud, abuse, security, and privacy regulations and the healthcare with the establishment of HIPAA. There were two goals with this legislation. One, make healthcare delivery more efficient. Two, to increase the number of Americans with health insurance. These goals were tied to the implementation of three provisions that included portability of healthcare records, tax provisions, and administrative simplification. Additionally, HIPAA mandated the development of nationwide security and standards and safeguards for the use of electronic healthcare information, as well as the creation of the privacy to protect that information. A couple of social factors drove the creation and updates to this legislation. First, many Americans, when transferring between jobs, were losing their health care insurance coverage. The portability provisions of this act has addressed that. Second, with the advent of advanced electronic data systems, there needed to be some guidelines in place to help protect patients' records that were stored in data systems, and then allow for a standard for transmitting these records between entities to ensure continuity of care. Subsequent updates have addressed the safety portion of the Act. HIPAA has provided many safeguards for the consumer and is a success. However, the medical community is always evolving. With the advent and use of social media, mobile devices, and the necessity of having to have access to data in remote areas, the attention required to ensure a secure data system is more important than ever before. Protecting the privacy and security of health information is a continuous process, and HIPAA will continually be reassessed to ensure it is working the way it is supposed to. This presentation showed how, from the oldest public hospital established in 1736 to the Affordable Care Act implemented by President Barack Obama in 2010, the goal has always been to find a way to take care of people. It outlines several key milestones in the development of the United States healthcare delivery system, the rationale for those events, important legislation, and key players who were involved in establishing the system. History has shown that while the United States has not yet adopted a universal healthcare system, the systems implemented protect as many individuals as possible and allows them to obtain access to the care they deserve.